Good afternoon. It's Tuesday, March the 10th, 11th. Thank you. And it's Thursday. Sego David Lahashu Juts, not off to a very good start, but we'll start again. Good afternoon. It is Thursday, March the 11th, 2021. Sego David Lahashu Juts, and welcome to today's edition of the COVID-19 Task Force Update on this, our 189th edition of the Kahnawake 911 Facebook Live. Today marks a very important date, as it was 1 year ago today the World Health Organization declared the COVID-19 pandemic, and of course that changed our way of life. We will be talking about that today, and as a matter of fact we'll have Lloyd, Phillips, Commissioner of Public Safety, to discuss that, and we'll also be speaking to Christine Taylor from KSCS, who's going to be talking about the other impacts of COVID and the way it's affected our lives and our mental health. And finally, we'll be speaking with Lisa Westaway, the Executive Director of KMHC. And now joining us is Lloyd Phillips. Lloyd?
Thank you very much, Dave. Yeah, 1 year. This is certainly when this was announced, a pandemic 1 year ago today, by the World Health Organization. I'm certain that nobody here, including myself, thought a year later we would still be in the midst of a pandemic. Little did we know a year ago, the world in front of us was about to change. And shortly thereafter, on the 13th, a matter of fact, was a major meeting that was held in Kahnawake with all the stakeholders in emergency management, emergency services, social services, and also obviously medical services got involved, and we started the process of addressing the pandemic issues. That was on the 13th, where the first, formal meeting took place. But prior to that, actually on March 4th, we did have the initial planning meeting. We were monitoring, we were assessing what was happening. Then we met the following week again as an update to the Emergency Preparedness Committee, just to make sure people are aware of what is happening. But little did we know, a couple days later, that there would be a major shift in the course of the pandemic, and it officially being declared as a pandemic on March 11th, and officially declared a public health emergency within the province of Quebec in Canada, and shortly thereafter it was declared as well in Kahnawake as a public health emergency, which the following week was also upgraded to a full state of emergency. So what happened during that time, obviously, is a lot of things. And just to touch back on a few key areas, and going back 1 year ago, there was obviously some of the first measures that were put into place to be able to address the potential spread of the virus within our community. And one of the first things that was done was actually the Kahnawake schools were closed immediately to address the pandemic. Daycares were initially closed. The Kahnawake Youth Center and the arena were all closed as areas where a lot of people congregate. Because certainly at the time we didn't know exactly what we were dealing with, so we had to take very strong measures very quickly in order for us to slow or stop the spread of the virus within our community. Shortly thereafter, we also had the gaming establishments in the community were closed down on March 13th. There was advisories that went out to iron workers working in New York and other parts of the country about travel restrictions, about border requirements, about isolation requirements. So there was a lot of things that were happening very rapidly. And on the 14th, then we also upgraded to a state of emergency. And at that time, all bars in the community, social clubs were closed, as well as restaurants were closed, as well as all the gyms and fitness centers in the community. So again, a lot of things over a short period of time, and I remember those days well, unfortunately, because it was a very tough time. We had to make some very tough decisions, and very quickly, and obviously, with a great team working together, we managed to accomplish a lot of these goals. We had started early on having essential services contingency plans developed for our community organizations, as well as there was a directive early on, which is now known as the KERM, the Kahnawake Emergency Relief Measures Fund, that was directed by the task force to be set up because we knew there was going to be some major impacts on the finances of Kahnawake who are operating in the industries within our community. So a lot of things happened. Obviously, the cigarette stores and factories were closed down in early March. There was even restrictions in the matter. There still is some restrictions, but there was initial restrictions on churches and gatherings and festivals and things of that nature. Again, because we had to take these strong actions early on to ensure that we were properly addressing the pandemic. Non-essential travel was banned. Anybody working for any of the community organizations was not permitted to travel to any place outside the province of Quebec. And then eventually we led to the following week where we formally had all non-essential business is closed. And then on the 24th, and then we moved into Kahnawake for residents only. And then it was that was basically at a time where we were in a full lockdown mode. Only essential services were being provided. Only essential business was operating in the community, and Kahnawake was restricted to residents only, and that had remained in effect for up until June 1st. So a lot of trying times behind us, and the actions we had taken during the first wave of the pandemic had proven to do us well. We had a minimal amount of cases during the first wave. We didn't have, obviously, we still haven't to this day any deaths. We had no hospitalizations. So that was a great move and decisions made for us to ensure that the first wave was contained. And obviously then throughout the summer, things kind of got able to relax just a little bit. Gatherings were permitted up to 8 people. Some travel restrictions were reduced. There was some in-room dining that was starting to roll out, as well as some gaming establishments that gradually started to reopen. School was being planned to reopen as well, and there was a plan that was put into place that would allow for schools to go remote and online learning if need be, if there was going to be a second wave. But if you recall, and early on in September, a second wave hit us hard and hit us fast in the community and across the country and for across the world for that matter, whereby we've seen the cases really skyrocket, and it came on earlier than anybody anticipated. Not that a second wave was not anticipated, but people figured it would be, in November, December, we might start seeing a second wave, but it came on very strong in September and into October. And then we quickly moved our schools remotely. Only a very small percentage of students were allowed to be in school, which is still the case today. Essential service workers and vulnerable children are allowed to be in school, but the vast majority of our students have been working remotely, going to school remotely. And so it's been a challenging time, to say the least. We understand the heartache it caused on families, but again, in hindsight, looking back at some of the decisions that have been made, we have fared the pandemic well. We still have 0 deaths in our community, and that's what everybody's hoping and praying that's going to remain that way for the remainder of the pandemic. We had a couple of hospitalizations, but fortunately those people have recovered, or are in the process of recovering, and we kept our numbers of actual people with COVID-19 very low in comparison to other First Nations, in comparison to other communities our size. We had approximately 110 total cases in Kahnawake to date. And given our location, geographically in the greater Montreal area, we're neighbors to the epicenter of the pandemic in Canada, but through the collective support of the community, we did weather the storm very well. Keep in mind, obviously we're not out of the woods yet. There's a lot of positive things happening, as we've been talking about for the past few weeks now. The vaccine center has been operating. Many of our health and social services, or the majority of our health and social services, people have been vaccinated. Many of our elders have already been vaccinated, and now the general population is in that process of being vaccinated as well. Keep in mind that once you're vaccinated, it still does take a 2 to 4 weeks before you do start building a level of immunity to COVID-19. So just because if you're vaccinated, it doesn't mean in the next few days that you're able to let down your guard and reduce measures. To the contrary, what we are having in effect is the current measures will remain intact for the next several weeks. I spoke on this on K103 earlier this week, and as a matter of fact this morning, that we need to remain vigilant. We need to remain the status quo in terms of measures that are currently in place, the limitations that are currently in place, in order for us to roll out the vaccine, allow our community to build that level of immunity, and that way we could reassess in the coming weeks on what measures can be reduced, what things could change, and how can we move back towards a state of more normalcy where there are less restrictions. But that's contingent upon having as many Kahnawake vaccinated as possible. That's why we keep encouraging people, if you have not been vaccinated, we have the month of March to continue making your appointments, and our goal is, again, to get 80% plus of our community vaccinated against COVID-19. And the more people we get done, the faster we could make those changes and allow for our return to our personal freedoms, allow for businesses to reopen, and allow, again, I think we're all been longing for a life that looks a little more like it did a year ago. So for the short term, because we've been getting a lot of questions because of the vaccine and the way it's rolling out, and people have been vaccinated, people have been asking, does this mean I could travel to the US? Does this mean I could go visit my elders? Does this mean many questions like that? At this point in time, just to be clear again, the status quo remains. So the border restrictions remain, the one household visitation per week remains, no gatherings indoors remains, minimal outdoor activities remains, until we have our community in a safe spot. We are definitely on the right track. Things are rolling out very well over at the vaccination center. We're having a high percentage of community who is willing to be vaccinated, and we hope that continues. And like I said, the faster we get there, the faster we can return back to normal, the faster our economics can get back rolling, the faster we could have our families visit again, and we could really reach out and hug our loved ones in a meaningful way and in a safe way. So it certainly has been a very challenging year, to say the least. There's been a lot of heartache on behalf of the community dealing with the pandemic. There's been many tough decisions and many sleepless nights, believe me, for members of the task force, knowing some of the tough decisions that had to be made, knowing that there's going to be restrictions. But ultimately, it's the benefit is with the community. The community has shown, as it does in any type of emergency in our community, standing strong, pulling together, and ensuring that we protect the most vulnerable in our community and protect our community as a whole. It's been a year. It's been a long year. We still have time ahead of us. So let's remain vigilant, and let's not forget that we're not out of the woods yet. We're not out of the pandemic yet, but we're certainly on the right track. We also have to acknowledge the fact that there has been major impacts on our community. We have, like I said, we have managed and fared fairly well in terms of the physical well-being of our community. We had, again, only 2 hospitalizations and 110 cases, but we didn't go unscathed, because there has been major impacts on people's social lives, their mental well-being, and that has not gone unnoticed. And that's something that will be continued to be addressed in the weeks and months and actually years to come, by the various institutions within our community. But we do have somebody here from KSCS today to speak a little more on that and give you some information. But with that, Kahnawake, I certainly and wholeheartedly appreciate the vast majority of the community who has stood with the task force, supported the task force. Even sometimes it may have been difficult. I know you had our backs, and that made the success in our community thus far possible, knowing that our community stands together, united, when we are confronted with a threat. And no, we are who we are, and that's why we are here today. With that, I pass it back on. Kahnawake, don't only go ahead.
Lloyd. Just to give you an update on some of our figures, so far to date, 1,259 vaccinations have been handed out to Kahnawake. That's 19% of our population. And joining us now from KSCS is Christine Taylor. Christine?
Thank you, Dave. Thank you, Lloyd. I'm here today representing KSCS in addressing some of the particularly mental health issues that we've been, dealing with the pandemic, which is a year now. So what I want to do right now is introduce something that we put together at KSCS in order to be able to give you something good and some information about what we're dealing with. Also, don't forget that this film that we put together, it's a presentation to offer some hope. And with that, I guess we can take it away. All right, welcome back. I hope you appreciate some of the work that we put into that presentation. And I guess more than anything, we want to urge people to take care of your mental health. Like if there's mental health stress, then there are mental health issues, and that could go on to addictions as well as suicide and other of those mental health issues in our community. For us, we want to say that connection and connection to one another, as well as to the professional services, are really important. And over the last little while, there has been a lot of pain being generated by the stress of the pandemic. And even though that can happen, I want to get across that having suicidal thoughts or wanting to escape by substance abuse or anything else like that, those are coping mechanisms and are very human, and we don't want to make anybody feel less than or make them experience the stigma associated with those. So it's up to us as a community to be able to open up our arms, open up our minds, and understand further what these what our own community members, our family members, are going through. And I myself am I'm a suicide intervention trainer, and I teach people how to recognize certain signs and symptoms when it comes to suicide. So I want to reiterate once again that suicide is a reaction to pain and loss, all right? And there's been a lot of pain and loss in the last year. I also want to mention that loss could be anything, okay? It could be anything from grieving from a death to also loss of mobility, loss of family members, loss of even just loss of health. All right, those are losses, and everybody reacts differently. So it's a very understanding thing when we want the pain to end. It's a normal reaction to pain and wanting that pain to end. It can happen to anyone at any time, all right? Because of the mental stress that we are all going through, these thoughts and ideas can happen at any time. There's no necessarily a high-risk group, but we're all at risk because this is a painful thing that we're all going through. So it can happen at any time, anyone at any time. Also, I want to mention that there are certain signs and symptoms that somebody could show if they're having thoughts of suicide. And I just want to mention that there are some, even though these are not necessarily, this is not an exhaustive list, and it has more to do with understanding what the person is going through at the time. And how do you get to know that understanding? Is by talking, is by discussing, all right? So some of the warning signs that might suggest someone is at risk of suicide include thinking or talking about suicide, and also having a plan for suicide. How are we gonna know that? By asking and exploring what these things mean to them. There's withdrawal from family, friends, and activities, and that is happening right now without us choosing it, so it actually puts everybody at higher risk. Feeling like you have no purpose in life or reason for living. Increasing substance use like drugs, alcohol, inhalants. Feeling trapped or that there is no other way out of a situation. Feeling hopeless about the future or feeling like life will never get better. Talking about being a burden to someone or about being in unbearable pain. Anxiety or significant mood changes such as anger, sadness, or helplessness. These might be signs and symptoms that somebody might be exhibiting, all right? But many times we don't know, and it could be anything. It could mean, maybe it might not be as apparent, all right? But it definitely can come out there, and it's up to us to listen to that person and find out what they're actually going through, talking, asking questions, and also offering help. There's no shame to asking for help, and I think that more than anything, the community has to let everybody know that it's okay. It's okay if you're not okay. If you need to talk, and you're not feeling like yourself, or you're experiencing a crisis or having emotional pain, know someone who does need help. What KSCS is going to be doing in the next little while is I am going to be mailing out the list of phone numbers. It's a nice small little thing. It's not like a big brochure where you would hand it out. This instead is going to be mailed out to each and every household in our community. And I just don't want to, it's very discreet, and it could be really easy, comfortable. If you're not sure or you're not comfortable with talking to somebody, maybe just kind of like give this to them and say maybe they might want to call somebody. There's also Need to Talk. All right, which is it's the First Nations and Inuit Hope for Wellness Helpline, which is out of Ottawa. The number is on the list. Also, I have a few others in terms of other issues that have been popping up, and that includes domestic violence, as well as substance use, and also sexual assault and a few other things. And again, this is going to be a little card, and that goes to people who might be experiencing an overdose, just to give you an idea of what you can do. If you're having thoughts of suicide, we've trained over 2,000 community members in suicide intervention. And if you see one of these somewhere, all right, that kind of shows that that person has received the training and is a safe person to approach or to ask for questions. If not, you can call KSCS. You could talk to one of the workers there. You can call the PKs if it's an emergency or crisis situation where somebody's very, very close. Then yes, you can call the peacekeepers for an intervention. Just don't let that person withdraw. All right, bring them out, talk to them, let them know, make them comfortable in talking about where they're at. All right, and there are so many different places that they can turn to. If they're not comfortable in coming to KSCS, that's okay. There are other places to go. And with that, we just want to say to the community, we're so proud of everything that you've already done. And we're still in this together, and don't be afraid to reach out, and don't be afraid to talk to people that you trust. And with that, I want to say thank you, and have a great afternoon.
Kahnawà, Christine. And next up is Lisa Westaway, Executive Director of the KMHC. Lisa?
Today, as many of you know, is a commemorative day. It was set as a commemorative day, March 11th, to remember and honor the lives that were lost over the past year. We are fortunate to not have any directly related COVID-related deaths. However, we still feel that it's important to acknowledge the impacts that COVID has had on our lives, and Christine referred to many of them while she was up here. We've had severe isolation, mental health, addictions, conjugal violence issues, impacts to our education, financial impacts, impacts to our spirituality. And these impacts, as we've said, will be felt over the coming years and are important that we address and that we talk openly about them. And so we want to acknowledge that these elements have impacted our daily lives, even if we haven't had death. They've had serious impacts on the way we live and the way we think about our lives every day. However, we also want to talk about, also want this day to be one to remember all that was done to prevent death and how the community has come together. Firstly, with the creation of the task force, this actually was a smaller reflection of a community coming together, with many community organizations banding together to make important decisions to prevent death. We were able to achieve immense feats by these decisions, creating the testing site, our local public health, having inspectors, mass vaccinations, communication strategy that allowed the community to be educated and empowered. we were able to regroup and break down barriers between organizations in order to make important decisions, all with common objectives in mind. But most importantly, we have you to thank, you, the community, who has done everything in your power to ensure that we protect lives through engagement, through buy-in, through coming together for common goals, to protect language and culture and our most vulnerable. And besides following measures and measures, you have developed on your own some wonderful initiatives over the course of the year that have allowed the community to protect each other in other ways besides simply preventing death, well, not simply, but in other ways that are just as important. Just to remind you of some of the fun Facebook groups that were created over the course of the year, some of the historical pictures, the scary posts, how we supported each other, how we reached out to each other in ways that we maybe never had in the past, how as individuals we all had to turn inward to think about what was important to each of us, how beading groups were started, people made donations of iPads to the hospital, how we turned to the land to grow our own food, how many testimonials were provided to demonstrate how people were feeling to try to reach out and help each other. There were many cultural initiatives that were started also throughout the course of the past year. And now more than ever, people are open and transparent about issues, about cultural issues that are impacting them on a day-to-day basis. And probably more than ever, we are focusing on family, community, social issues, which are providing us with an opportunity for change and growth. So on this commemorative day, it's not just about the negative, but I really urge each of you to think about what you have done over the past year, how the smallest thing has contributed to the protection of the community, and thank yourselves as we thank you today for everything that you have done in this fight against COVID, and that we continue to do. Thank you.
Thank you very much, Lisa. And just a reminder before we go that you can now book your appointment for your COVID-19 vaccine by visiting Kahnawake911.com/vaccine. And you can also call KMHC if you have problems with the website at 450-638-3930, extension 2295. And that's it for today's update for this Thursday, March the 11th, 2021. From all of us here, thank you very much for watching. Stay safe. Yawagoa, Danu, Onagiwahi.
I will absolutely 100% be getting my vaccination as soon as possible. You know, for the last year, almost a year now, COVID has been running all of our lives, and I think that finally this vaccine is here. Science has really, came up and, has pushed this vaccine, and I believe it's the right thing to do. It's my way of having some control over this and not COVID running me or our lives any longer. I've watched, programs, I've done some research, and I'm on the task forces, and to me, all science is saying this is a safe, it's a safe vaccine, and I think it's the right thing that all of us should do. People are fed up with it. I'm fed up with it. I'm tired of it. I want to go back to some sense of normalcy. I want to be able to hug my, the members of my family, and especially the kids, the children. I want to be able to go sit at my mom and dad's and sit there and have lunch and dinner with them or breakfast. And right now it's been hectic on every single one of us. I'm tired, like everybody sitting at home watching this is tired. I'm tired, I'm fed up, and I just want some type of normalcy, like I said. And I think this is the right way moving forward. And I think it's an obligation, that we all should take very, very seriously to help our community and help the world get over this once and for all.